Of course, that's looking out at the vaccine plans that will come potentially, well into the second quarter of 2021. Still a lot of questions to be talked about here about what could happen with the holidays approaching. And joining us now for more on that is one of our favorite coronavirus experts here, and Dr. Michael Saag. He's Associate Dean for Global Health at the University of Alabama at Birmingham, and he joins us now. And Dr. Saag, it's good to have you back with us here. I mean, you heard Anjali talking about some of those case count numbers, but when you think about what could happen, if we're already at 150,000 now, as we approach Thanksgiving, you're going to have a lot of family members intermingling with some older aged populations more susceptible to this disease. Talking about how bad it could get, as we haven't seen deaths really increase where we were back in earlier in this year, but how could that all change heading into the winter?
Well, it's a little bit like a tale of two cities. We got the best of times and the worst of times. So we just heard about vaccines. That's great, but we're headed into the worst explosion of cases that we've seen, and there's no end in sight because the numbers just keep going up almost exponentially, as you said, 153,000, and we have the holidays coming up. My advice, regardless of whatever the public health rules are, is I would stay at home. I would think about canceling, honestly, Thanksgiving get-togethers. I know I sound like the Thanksgiving equivalent of Ebenezer Scrooge, but we are in the middle of a pandemic that is exponentially growing. And so I would say keep the numbers very small, tight, use Zoom, use other electronic media to connect. But this is a really bad time to travel. And this is a bad time, even within a family unit, to bring large groups of people together.
And Dr. Saag, that's something we've heard from a lot of doctors who say, look, as much as you have that desire to gather as a family, just try to avoid it because that could be a big spreader going into the holidays. The vaccine part of it, Anjali just talked about this. How should we be looking at that? It sounds like because this is a 2021 event, the focus should potentially be more on the testing, and yet we're starting to see those lines build up again across the country because there just aren't enough tests and they're not turning those results around quick enough.
Yeah, I think the vaccine news is outstanding. None of us expected 90%. And yeah, it may drop a little bit, but that's probably close to it. And the other good news there is that, in my opinion, it's likely that several of these other candidates are also going to be home run hits. So that means we're going to have more options than the Pfizer drug or vaccine over the long run. But your point is well taken. I think what's scaring, and I use that word advisedly, the thing that's scaring a lot of us in the hospital setting is that we're getting overwhelmed. And when hospitals fill up, what are our options? What can we do from there? So the testing lines, as you mentioned, those are getting long. I think we have capacity for the testing. I'm not as concerned about that. I'm worried about bed space. And you mentioned deaths, but remember, this goes in a wave. You start off with the cases, then the hospitalizations, and unfortunately the deaths follow. So expect high death rates come the early to mid-December.
Akiko brings up testing there, and we did get an update from Elon Musk. He's not one of those voices that we would turn to in a pandemic as necessarily a coronavirus expert, but he was talking about testing himself there. And on that front, I'll just say what he said here. He said something extremely bogus going on, pointing to his own personal experience. He said he was tested for COVID 4 times. Two tests came back negative, 2 came back positive, same machine, same test, same nurse. I'm not sure necessarily if the advice out there would be for one person to get tested 4 times. But when we are talking about going back home for the holidays potentially here, I have heard people maybe doing a rapid test and then following it up with another test to be sure, since there are false negatives. What's your advice around testing here as people should be thinking about this?
Be careful, because especially with the rapid antigen test, if somebody doesn't have symptoms, that test can be falsely negative 30, 40% of the time, depending on details. But so it only is really helpful if the test is positive. So a negative test, even if it's truly negative, doesn't mean that that person wasn't exposed the day before the test and then 3 days later ends up with COVID. So it's not a great strategy. We've used it in college sports, for example, and they've used the rapid test 3 times a week, but at some point it breaks through. And we see all kinds of games being canceled this weekend. And the reason for that is widespread community exposure. Putting this all together, what we're really dealing with is hope on the horizon with a vaccine, but a disaster happening right now in the real time with the number of cases. And what we have to do is commit to bridging to that moment when we have vaccines available. And that's why I think it's important for us to triple down, quadruple down on the things we know to do to get it under control. And I don't want to use the word lockdown, but maybe just personal commitments to minimizing our activities outside of the home until we get through this surge, this actually spike of cases that we're going through right now.
And doctor, when you talk about the vaccine, certainly a lot of questions about distribution. These stories that we're hearing from hospitals right now, not in a place like New York City where we are, but some of these other Midwestern states, for example, they are having their hospitals overrun. They don't have enough beds in place. How big of a hurdle is that going to be when it comes time for the vaccine to actually be distributed, when hospitals are so overwhelmed with taking care of the patients who are already infected?
It's a great question, and one I don't have a great answer for. I think you've hit it on the head. We all only have so much capacity to do what we can do. I think the federal government has committed to this with the warp speed. They consider distribution. So we have those options available, and we can pull emergency use of all types of resources at our government's disposal, maybe augment. But the point about the overwhelming nature of this for regular health systems cannot be understated. This is something we're all very concerned about. And I'm not an alarmist, but I am concerned about where we're headed. So my plea to everyone is to triple down, quadruple down on the things we know to do. And I would say stay at home, even if there's not a lockdown, stay at home thing. Just be smart.
Well, I mean, when we talk about the likelihood of lockdowns coming through here, it doesn't seem likely because, we've heard even from Dr. Fauci that there's not a lot of public appetite right now for something like that. But to your point, you're not an alarmist, but there are a lot of alarming situations playing out right now in terms of hospital staffs being stretched. We're seeing that play out in El Paso right now. So on that front, there are a lot of people here pointing to the fact that European nations, when they did lock down again, immediately saw things improve to at least provide some temporary relief. So real quickly, I mean, what would be your take on maybe the idea of lockdowns returning here in the U.S.?
I think we're going to have, it's an equation. We know from a public health perspective, it's absolutely the right thing to do. It will work. The problem is the economic fallout, the financial fallout that all of your listeners are concerned about. So from my perspective, we have to do some high level evaluation of the cost of lockdown versus the cost of not locking down and having this thing continue boiling over for the next 3 to 4 months. That's a scary proposition from my perspective.
Absolutely. There's a lot of scary propositions to dig into here, but I appreciate you addressing the health concerns there for us. Dr. Michael Saag, Associate Dean for Global Health at the University of Alabama at Birmingham. Appreciate you joining us again, and be well, sir.
Thank you. Thanks for having me back.